Hello, I'm Tim Brinker, the Presiding Commissioner of Franklin County, Missouri. The governor's stay-at-home order is in effect and will continue through April 24th. Please continue to strictly adhere to the order. Stay home, avoid close personal contact, 6 feet of distance, and no groups or gatherings greater than 10, and be nice to each other while you're at it. I want to introduce Angie Hittson, the Franklin County Health Department Director. She's going to give us a word. Angie?
Thank you, Tim. The Franklin County Health Department has spent the last several months planning for and responding to COVID-19. Our job in public health is to prevent the spread of disease, promote wellness, and protect you, the citizens of Franklin County. The strategies that we implement are based off of data obtained from testing. And unfortunately, right now that data is limited because testing is limited. Currently, we have only a small picture of what is in our community. And our caseload right now stands at 65 confirmed cases of COVID-19. There are a variety of zip codes and demographics presented in this caseload. And what we know is this virus is here, it's continuing to spread. We know that the virus is spreading through person-to-person contact and through community transmission. While we have no control over testing, we do each have control over the spread of this virus. Staying home is really all we can do right now to protect ourselves. Yesterday, it was released publicly that a long-term care facility in Washington has confirmed cases. That is true. They, like many other long-term care facilities, have been preparing for this virus over the last few months. They followed all procedures and guidelines that were recommended, and they still experienced widespread illness. They will not be alone in this, I am afraid. This virus, in many ways, is invisible, and it presents unique challenges to long-term care. This example of spread in one community is just one example of how rapidly it can spread. Currently, we know our healthcare system has the capacity to care for all of those in need, but very quickly that could change. This is why we have to remain diligent. We must stay home. We know these adjustments are not easy, but we do hope they're short-term. In time, we will all be back to school, back to work, back to our ball games, our barbecues, and our social gatherings. Until then, let's all do our part. Let's be kind. I'd like to take a moment to ask all of you to please help build the spirits of those that are scared, anxious, and tired by kindly replying in the comment section. Please join me in thanking our essential workers. We see you and we thank you. Please join me in also saying thank you to our first responders, our healthcare workers, our public health officials, and all of our elected leaders. The hours are long and the challenges have been many. We are adapting and adjusting constantly. In closing, I'd like to say thank you to the County Commission, to the County EMA, and to my staff at the Health Department. Also, a big thanks to my family. Your support, encouragement, and kindness has been just completely invaluable to me. Thank you.
Thank you, Angie, for your leadership in health and also for your team in our health department. Above and beyond is a consistent term for you and your staff's service level. The St. Louis Regional Pandemic Task Force, the report states that as of today, within the St. Louis region being reported by the 4 major hospitals of Mercy, BJC, SSM, and St. Luke's, there are 586 people currently hospitalized, 239 in intensive care, and 186 utilizing ventilators for oxygenation. Your county staff is still on split shifts so as not to lose an entire department to quarantine if need be. We are also evaluating dates for existing commission orders to be extended to either the 24th of April or the 1st of May. We will advise accordingly. The flu report is really good, which tells us 2 things. First is that the distancing is working. And second is that because flu is now minimized, we will not have a bog in the testing process and will truly be testing for COVID-19 without the flu symptoms giving false positive implications. I will be on a conference call tomorrow with Governor Parson and inquire on 3 major needs. First is PPE status. Second is test kit status. And third is relief dollar status. I will relay all those answers when attained, sometime after tomorrow, hopefully. Someone made mention to me of a mantra they use every day. They said, when you wake up, just think that everyone has the virus but you, and your behavior will truly change into what we are trying to achieve. I agree. Thank you all. Keep praying, be safe, and God bless.